Have you ever found yourself maybe wrestling with a really complex medical topic, needing to get up to speed fast, but just feeling completely overwhelmed by all the information out there? It's a common feeling. Well, today, we're aiming to cut right through that noise for you. Welcome back to the Deep Dive. Our mission, as always, is to take your source materials, articles, research, maybe even our own notes, and boil them down into the most essential insights. It's all custom tailored for you, our listener. And today, we're tackling a topic where timing is just everything. Preterm labor, our goal, to give you a really comprehensive yet super digestible understanding so you walk away feeling truly informed. Okay, let's unpack this straight away. When exactly are we talking about when we say preterm labor? Because that timing, it feels absolutely critical, not just for the definition, but for, what happens next.
It really is. It's all about precision here. So preterm labor is specifically defined as the onset of labor happening between week 20 and week 37 of pregnancy. That's the crucial window. It's before the natural full-term due date, which we usually consider at or after week 37.
After 37 weeks is full term.
Got it. Exactly. So if labor starts even a day before that 37-week mark, well, it falls into this preterm category.
That 20 to 37-week window really puts a fine point on it. Is there something often misunderstood about that specific timeline? Or, I guess, why is being so precise about those weeks so important for a good outcome?
Yeah. What's often misunderstood is maybe thinking any labor before the due date is just generically early. But this specific 20 to 37-week period is so critical because it's really the time frame where interventions can often make the biggest difference for the baby's development, especially things like lung maturity, and for the overall health of both mother and child. Before 20 weeks, it's usually termed a miscarriage. And like we said, after 37, it's full term. So this window demands a very specific medical approach.
I see. So the precision really dictates the urgency and the kind of care needed.
Okay.
Knowing that then, for someone who might be experiencing it, what are those really early indicators? And maybe more importantly, what are the subtle signs? The ones people might easily brush off as just, normal pregnancy discomforts.
That's a vital distinction to make. Recognizing these signs early is just paramount. So you should be looking for several key things. The more obvious ones might include repeated abdominal tightening or contractions. They might feel regular, or maybe just different from those Braxton Hicks contractions people get familiar with.
Right, the practice ones.
Exactly. But the subtle ones, the ones often overlooked, can include things like a persistent low, dull backache. Not just a temporary ache, but one that sticks around. Also, a feeling of pressure down in the pelvis or lower abdomen, almost like the baby is constantly pushing down. Mild cramps, too, maybe feeling like period cramps. Those can be a significant warning. Then, of course, any spotting or light vaginal bleeding that always needs attention. And a really critical one, preterm rupture of membranes, PROM. Basically, your water breaking early, even if it's just a trickle. And finally, any noticeable changes in vaginal discharge, like if it suddenly becomes watery or very mucus-like or even bloody, that should also prompt immediate attention.
What seems particularly challenging is recognizing those early signs like the low, dull backache or just mild cramps.
Yeah.
They could so easily be dismissed, couldn't they? Just part of being pregnant? How do we tell the difference? And what's the hidden danger in maybe overlooking those seemingly subtle things?
You've hit the nail on the head. That's the precise difficulty. These subtle signs are often the earliest warnings, but because they can mimic common pregnancy discomforts, they're frequently overlooked or just chalked up to something else. The hidden danger is really about progression. If these signs get ignored, the labor can advance pretty quickly, and that makes interventions less effective. And speaking of critical signs, the source material really emphasizes a key point about that preterm rupture of membranes, the PROM we mentioned.
Right.
What's fascinating and frankly deeply concerning is that PROM, the early breaking of water, it carries the significant and immediate risk, both for infection and for subsequent preterm delivery.
Okay, so it's not just the water breaking itself.
No, exactly. It means if PROM is suspected, monitoring for signs of infection like a rising temperature or elevated white blood cell counts becomes absolutely critical. It's about that increased vulnerability to serious infection for both mother and baby that follows, which can potentially speed up the labor process.
Yeah, it makes perfect sense. It's like the body is trying to send these signals, and you really need to listen closely. Which makes me wonder, when we talk about what causes these signals, what actually puts someone at a higher risk for preterm labor to begin with? What are the common and maybe the more surprising risk factors we should know about?
Well, there's a remarkably wide range of factors that can increase the risks. Some are quite obvious, maybe, others less so. A history of previous preterm labor is a big one, especially if it was recent or happened more than once. It's like the body kind of remembers.
Hmm.
Carrying multiples, twins, triplets, or more, that naturally increases the strain and risk just due to the uterus being stretched more. Makes sense. Then there can be problems with the uterus itself, or the cervix, or the placenta. Those structural issues can predispose someone.
Okay, those seem fairly direct. What else?
Beyond those direct anatomical or historical factors, lifestyle choices definitely play a role. Smoking or using illicit drugs are clear risk factors. Infections are a major concern too, particularly infections affecting the amniotic fluid or the genital tract. These can trigger an inflammatory response that basically kicks off contractions.
Infections, okay.
Chronic diseases like uncontrolled high blood pressure or diabetes, they also contribute to the risk. But what's truly eye-opening is just how diverse these risk factors become when you dig into the sources. We also see physical things like polyhydramnios, that's too much amniotic fluid,
Polyhydramnios, right?
or any instance of vaginal bleeding during the pregnancy. Even a congenital malformation in the fetus itself can be a factor. Then there are factors related to, like, pregnancy spacing. Having less than 6 months between pregnancies might not give the body enough time to fully recover.
Only 6 months. Wow.
Yeah. And finally, something that often surprises people, periodontal disease. We're talking severe gum and tooth infections.
Periodontal disease. That is surprising. It's truly remarkable how far-reaching these risk factors are. I mean, from an infection in your mouth to something profoundly personal, like the death of a loved one, which is also mentioned in the sources. Can you maybe give us a sense, even metaphorically, of how these seemingly unconnected things might actually contribute to something as specific as preterm labor? What does it tell us about how our bodies are interconnected?
It absolutely highlights the intricate interconnectedness of the human body way beyond what we might initially think. Now, the sources don't detail every single biological pathway, of course, but including something like periodontal disease strongly suggests that chronic systemic inflammation or infection, even starting in the mouth, can potentially trigger inflammatory responses elsewhere, including in the uterus.
I mean, like a ripple effect.
Exactly. The body, in a sense, sees a threat somewhere and can react globally. And similarly, the profound physiological and hormonal stress that comes from psychologically impactful events, like losing a loved one, that can lead to hormonal imbalances or physiological reactions that directly influence uterine activity, sometimes initiating labor.
Wow.
It's just a powerful reminder that pregnancy isn't happening in isolation within the uterus. It's this really complex interplay of various body systems, external factors, stress, everything potentially influencing everything else.
That's incredibly insightful. It really makes you appreciate the sort of holistic nature of health during pregnancy. And knowing why it might happen, understanding these diverse risk factors, that naturally leads us to the next crucial question. What can actually be done, both to prevent preterm labor, and if it does occur, what are the key treatment approaches that healthcare providers use?
Right, so when it comes to prevention, regular, consistent prenatal care is just absolutely foundational. That allows providers to monitor for risks, spot issues early, and manage potential complications before they escalate. Maintaining healthy and balanced nutrition throughout pregnancy is also crucial, giving the body the resources it needs. And of course, avoiding harmful substances, alcohol, smoking, illicit drugs, that's vital. These are well-established threats.
Makes sense.
Regulating the time between pregnancies, maybe allowing at least 18 months, that can also reduce risk. Gives the body adequate time to recover. And for those considering assisted reproductive technologies, RT, like IVF or other fertility treatments, caution and thorough discussion with the specialist are important. Mainly because RT can increase the risk of multiple gestations, twins, triplets, which, as we said, is a significant risk factor for preterm labor itself.
Okay, so those are preventative angles. What about when preterm labor is happening?
Right. If preterm labor does occur, then medical interventions focus on two main goals. Either trying to stop the contractions and prolong the pregnancy if possible, or preparing the fetus for an early but as safe as possible arrival. One key medication used to try and stop contractions is terbutaline. It's a type of drug called a tocolytic, basically designed to relax the uterus and reduce those contractions.
Briefly.
Then there's magnesium sulfate. This one has a fascinating dual role. It can help protect the fetal brain, especially in very premature infants, reducing the risk of things like cerebral palsy, and it also functions as a tocolytic to help prevent preterm birth.
So brain protection and stopping contractions.
Exactly. And another critical medication is betamethasone. Its main job is to stimulate the maturation of the baby's lungs. This is vital for babies born early. It's usually given as a course of injections.
Betamethasone for lungs. Got it.
Hydration is another tool. Sometimes just administering IV fluids can improve perfusion, that's better blood flow to the tissues, and that can sometimes calm down uterine activity and reduce contractions.
Interesting. Even just fluids can help.
Sometimes, yes. And finally, given that infections are a common trigger, actively treating something like a urinary tract infection, a UTI, is a direct and often very effective intervention, because a UTI can indeed directly cause preterm labor.
It's really interesting how specific yet complementary each of these treatments are. From using fluids for contractions to that dual brain protective role of magnesium sulfate. It really shows the multifaceted, kind of layered approach needed to manage this. Clearly not a one-size-fits-all situation. Requires a careful balance.
Okay, let's try to put this into a practical scenario. To really tie it all together for you, our listener, imagine a patient, she's 30 weeks pregnant, comes in complaining of persistent pelvic pressure, maybe a trickle of fluid leakage she noticed, and regular increasing contractions. As a healthcare provider, what actions would be absolutely critical in that moment? What are the immediate priorities? Okay, yeah, this is a classic scenario, and it demands immediate, decisive, and kind of integrated action. First and foremost, you'd need to rapidly evaluate for prom checking for that fluid leakage, maybe using a specific test like a nitrazine or Fern test to confirm if the membranes have actually ruptured.
Check for prom first.
Simultaneously, starting fetal monitoring is absolutely critical. You need to assess the baby's heart rate, movement, overall well-being right away. Given the 30-week gestation and active signs of labor, administering betamethasone would be a super high priority. You want to accelerate that fetal lung maturity. Every hour counts there.
Betamethasone, yes.
At the same time, ticolytics like the terbutaline or magnesium sulfate we talked about would definitely be considered and likely given to try and reduce those contractions and buy more time, prolong the pregnancy if possible.
Try to stop the labor.
Exactly. And because prom and labor symptoms carry that significant risk for infection, checking for infection is paramount. Maybe drawing blood for a white count, possibly cultures. And the absolute critical takeaway from this scenario, something emphasized in the source material and just standard clinical practice, is that you simply do not discharge home.
Right. No sending them home.
Absolutely not. This patient needs immediate hospital care, close monitoring, and a full assessment to figure out the best course of action for both mother and baby. Delaying intervention here could have really significant consequences.
That scenario definitely solidifies the information and drives home the urgency. Okay, so if we were to sum up the most important takeaways from this entire deep dive for you, our listener, what would those key concepts be? The things they should really remember?
In essence, I'd say remember these core concepts. Preterm labor specifically means labor happening before 37 weeks of pregnancy. Preterm rupture of membranes, or PROM, always carries that significant and immediate risk of infection. Remember that connection. Betamethasone is that critical medication for fetal lung maturity. Think lungs, think betamethasone. Terbutaline and magnesium sulfate are your primary tools for attempting to stop contractions. And remember magnesium sulfate's dual role in protecting the fetal brain, too.
Right, the dual role.
And don't forget that a seemingly simple urinary tract infection, a UTI, can be a possible direct cause of preterm labor itself, so treat infections.
Okay, those are great key takeaways. So if we connect all this to the bigger picture, what's the single most important thing for our listener to walk away with from this deep dive today?
I think the absolute most important takeaway for you, our listener, has to be the critical importance of early recognition of any potential symptoms, combined with the need for appropriate, immediate medical intervention. Time truly is of the essence when it comes to preterm labor. Don't dismiss those subtle signs we talked about, and always, always err on the side of seeking medical advice sooner rather than later.
Absolutely. Early recognition, prompt action, it sounds like, that can make all the difference, potentially really altering outcomes for both mother and baby. Thinking about the incredibly diverse range of risk factors we discussed today, everything from chronic diseases to psychological events, even surprisingly, gum infections. What does this tell us about the truly holistic nature of pregnancy health, and maybe about the intricate connections within the human body that we're perhaps still working to fully understand? It really makes you consider how interwoven everything is, doesn't it?
It truly does. It just underscores that pregnancy isn't some localized event happening just in the uterus, right? It's this profoundly complex interaction involving the entire physiological and even the psychological landscape of a person. Understanding these diverse, sometimes unexpected connections really pushes us to think beyond just isolated symptoms, to consider the broader well-being, physical and mental, that contributes to a healthy pregnancy outcome. It definitely highlights that we're still uncovering the full symphony, if you will, of factors that influence the beginning of new life.
A powerful thought to end on. A great reminder to always look at that bigger picture when it comes to health. We really hope this deep dive has given you a clearer, more confident understanding of preterm labor and all its complexities. Keep learning, keep asking questions, and we'll be here with your next deep dive.